Hello, everyone. Welcome. I'm Janet Cummings. I'm the Deputy Director of the Southeast Mental Health Technology Transfer Center, and I'm the Project Director of our School Mental Health Initiative Team. I'm so excited to be moderating today's session. Thank you for joining session 7 of our 8-part series. Today, we're going to be covering Module 7, Funding and Sustainability, in our MHTC School Mental Health Best Practice Always and Now series. So we have a couple of housekeeping items before we begin. To make sure you have the best audio quality, we have muted mics for all participants except for the speakers. If you have audio or technical issues during this session, the chat box is open for you to communicate with our team. And if you have a link to any resources you want to share with the panelists, or if you have any questions for panelists, please put those in the question and answer pod. Now, note that we have scheduled time for Q&A at the end of the session, but you're also welcome to put those questions in there at any point. We've made every attempt to make today's presentation secure, but if we need to end the presentation for any reason, unexpectedly, we will follow up with you using your registration information. You'll receive an email following the presentation on how to access the certificate of attendance. The session recording and slide deck will also be posted on our website in a few days' time. And if you don't already follow us on social media, please do. Follow us on Twitter, Facebook, and stay in touch with us to find out about more upcoming opportunities. For those of you who are joining this series for the first time, this 8-part series is a collaborative effort of the Mental Health Technology Transfer Centers, or MHTTC for short. We're a network funded by the Substance Abuse and Mental Health Services Administration, which includes 10 regional centers, a national American Indian and Alaska Native Center, a national Hispanic and Latino center, and our network coordinating office. Our collaborative network supports resource development and dissemination, training and technical assistance, and workforce development for the field of mental health. After today's session, please visit our website to find your regional center and keep in touch with us to find out about more resources and training opportunities. Today's session is being led by the Southeast MHTC School Mental Health Initiative Team. We're located in Atlanta, Georgia at the Emory University Rollins School of Public Health, and we're proud to serve the 8 states pictured here in HHS Region 4. So our team includes faculty and staff with expertise in public health programs, finance, policy, and health systems, which gives us a unique lens through which we work to accelerate the adoption of evidence-based programs and practices throughout the region. Very brief disclaimer before we continue. This presentation was prepared for the MHTC network under a cooperative agreement funded by the Substance Abuse and Mental Health Services Administration. The opinions expressed here in the learning session are the views of our moderator and panelists and do not reflect the official position of the Department of Health and Human Services, or SAMHSA. And then, as part of receiving SAMHSA funding, we're required to submit data on the quality of today's event. So after the training, we ask that you take a moment to complete a very brief survey about how today's session went. And one more quick reminder before we dive in, we are hosting regional breakout sessions. So these sessions are intended to provide an opportunity for you to have some informal discussion moderated by staff with other participants from your region. To participate in the 30-minute regional breakout session, we'll provide you access to a link at the end of today's presentation. Okay. So now it's time to dive into some great content that we have prepared for you today. As many of you know, this 8-part training series uses the National School Mental Health Curriculum, guidance and best practices for states, districts, and schools. But before I continue, I just have to highlight to everyone a title change that we've made recently. Our network, in partnership with the National Center for School Mental Health, decided to remove the word curriculum from this resource. And this was based on feedback from you, our constituents. So this resource will now be referred to as National School Mental Health Best Practices, Implementation Guidance Modules for States, Districts, and Schools. This resource was developed by our network in collaboration with the National Center for School Mental Health in 2019. It's intended to help states, districts, and schools advance comprehensive school mental health systems. It includes trainer and participant manuals, 8 sets of slide decks for each module representing the core features of comprehensive school mental health, and also a number of additional resources. So today's live session is going to consist of a discussion with a panel of experts and leaders who will provide an always and now application of the best practices for Module 7, Funding and Sustainability. So while the modules are a great resource to use in typical school settings and typical times, we think they're especially relevant in the current context with the ongoing pandemic and the impact it's had on school mental health services. And now we are so excited to have Dr. Nancy Lever with us today, who is a co-director of the National Center for School Mental Health and an associate professor in the University of Maryland School of Medicine. She's going to start us off with a brief recap of the module. So thanks for being here with us, Nancy, and I'm going to pass it off to you.
Okay. Thank you so much, Janet. Hi, everyone. Hope you had a chance to review Module 7 on funding and sustainability in advance of today's webinar, but don't worry if you haven't. I'm going to share some highlights of the module prior to our panelists to provide some foundational knowledge. In this module, we review the definition of school mental health funding and sustainability and consider an array of opportunities to secure and leverage diverse funding sources to sustain successful school mental health systems. We review national standardized performance indicators for funding and sustainability, or what we refer to as quality indicators. For each of the indicators, we outline best practices and offer some helpful tips, reflections, district and state exemplars, strategic planning, and some very practical resources. So what do we mean by the term school mental health funding and sustainability? School mental health funding and sustainability looks beyond just dollars and includes the strategies to optimize financial and non-financial assets needed to maintain and improve your school mental health system over time. It's important to remember that financial considerations look beyond just fiscal dollars to consider broader resources and assets. Sustainability is always evolving, but the goal is to ensure that your operational structures and capacity are sound and that your system can grow and adapt to match the changing needs of your students, families, schools, and communities. Here's a list of quality indicators for the funding and sustainability domain. I'm going to briefly describe each one. In this quality indicator, we look to the use of multiple and diverse funding and resources to support a full continuum of school mental health services and supports. Best practices include using funding from different levels, such as school, district, state, federal, types of funding such as grants, third-party reimbursement, and having funding that aligns with the funding needed for the tier. Perhaps what is most helpful in the module are examples from districts and states. Here's one example of an urban district in Maryland's use of blended funding that pools and leverages funding from multiple sources. And here are some state exemplars. Pennsylvania as a state that expertly uses braided funding to support school mental health. Alabama effectively uses funding to support new positions, including school-based mental health service coordinators and master's level clinicians. We're really fortunate to be able to hear more about Alabama from Lynn in our panel today. We also have examples of state appropriations from Kentucky and Tennessee for funding school-based mental health providers and school-based behavioral health liaisons. So again, these are really helpful examples from our states. Another quality indicator is leveraging funding and resources to adequately support a comprehensive school mental health system. Always thinking about new partners to include and how to leverage funding are best practice considerations. The module offers helpful tips for leveraging funding resources, such as how to effectively develop a memorandum of understanding, or MOU. And there's some great templates that you can use. Another quality indicator considers strategies that are in place to retain staff. Retention of staff is critically important for student, family, and school staff relationships and trust, and is cost effective. So hiring and training new staff we know is time consuming and costly. So here's a list of best practices. Some examples of best practice include regularly recognizing accomplishments and personal milestones, flexible work schedules, and incentive-based pay. It's also critical to think beyond just individual staff self-care to consider broader organizational factors that contribute to staff well-being and reduce burnout. The organizational self-care checklist is one example of how to begin to address system issues related to staff well-being. Another quality indicator involves maximizing the expertise and resources of all stakeholder groups to support ongoing professional development activities. We need to recognize the strengths and skills of our family, school, and community partners in providing professional development, and to make sure that all partners have opportunities for advancing knowledge and skills. The last quality indicator considers the extent to which there is funding and resources to support each of the tiers of the multi-tiered system of support, and to what extent schools are maximizing reimbursement opportunities for eligible services. It's important to move past the idea that funding from treatment services can provide funding to support the full triangle. There needs to be funding that matches the services and supports that are provided. Other considerations include figuring out how to maximize fee-for-service funding mechanisms, both public and private, to support mental health. Here are some helpful reflection questions, as well as worksheets and tools to move the topic forward. The module also considers how to influence policy related to school mental health. Working with key knowledge leaders and advocates can help inform the most effective policy to influence school mental health in your state. So one example for state policy I encourage you to check out to advance school mental health services and supports is from the state of Nevada and its state-funded block grant program that provides full-time social workers. As a next step, you can bring this content back to your district and begin strategic planning, which includes creating specific goals and action steps for comprehensive school mental health. Using the strategic planning guide in conjunction with module resources, including the School Mental Health Quality Guide for Funding and Sustainability, offers schools and districts tools and strategies to move funding and sustainability efforts forward. So that is your Cliff Note version of the module. Hope you'll check out the full module if you haven't had a chance to do that. Let me turn things back over to Janet.
Thanks so much, Nancy. We really appreciate that recap of Module 7. So now we want to jump into the next portion of our session, our panel discussion. I'm so excited about the all-star panel that we have for you today to provide some more information about school mental health funding and sustainability. So first, we have Ashley Harris, who is the Georgia Department of Education's Director of Whole Child Supports and Strategic Partnerships, a role created to cement the department's shift toward a common framework of improvement with the whole child at the center. Ashley leads the department's efforts to address students' well-being in the learning process, to address the non-academic factors that impact student achievement, and to maximize educational opportunities. She has more than 15 years of experience in education administration. We also have Lynn Bashir, who is the former commissioner of the Alabama Department of Mental Health, a post she held from July 2017 until this past December. During her time in this role, Lynn oversaw significant expansions of school-based mental health partnerships, as well as an expansion of the school mental health workforce. Prior to serving at the Alabama Department of Mental Health, she served as an executive director of Envision 2020, a strategic planning process that prioritized establishing a coordinated, sustainable regional system of mental health care in several central Alabama counties. And then finally, we have Dr. Adam Wilk, who is a health economist and health policy researcher at the Emory University Rollins School of Public Health. He has 15 years of experience in Medicaid consulting, technical assistance, and research. His research focuses on access to care for low-income and underserved populations, as well as state financing and policy related to providers' operations and care. So thank you all so much for being here today. We're going to stop sharing slides so that everyone can see our panelists. And I'm going to kick it off with a question for Ashley. So Ashley, could you talk to us about potential funding sources schools can access to support student mental health from the perspective of departments of education?
Absolutely. Well, but first, before we can talk about funding, it's important for us to distinguish two things. One, there isn't dedicated funding allocated by federal programs to support mental health outside of really students with disabilities. There are programs that you can use to support mental health, but there are no dedicated funds. So each state has the autonomy to create funding, but federally there isn't dedicated funding for mental health and education outside of students with disability, which has its own specific regulations and guidelines. The second thing you should remember is that there is a distinguished difference between mental health services, which are generally billable. So think individual student counseling versus mental health support, which is generally non-billable. So think tier 1 support, social emotional learning curriculums, or what we call here in Georgia, connectedness and well-being. So when we talk about mental health services, these are the direct services provided to individual students based on an established prerequisite. So some schools and districts may be doing individual student assessments, connecting interventions to students with disabilities, or allow students to self-refer. Again, these are generally billable. For example, individual therapy for a child that has a diagnosis. Mental health supports is a little different. These are upstream preventative measures, we implement to promote healthy mental health development that are, again, generally non-billable. These are generally and usually tier 1 supports and interventions as well. With this understanding in education, we have a few ways to fund mental health services and supports in schools. For mental health services, schools can opt to use part of Title IV-A, created under the Obama administration with the updated federal education policy, ESSA, IDEA funds, which are special education funding, and McKinney-Vento, which is federal funding targeted towards students impacted by homelessness to pay for students who do not have billable insurance. Keep in mind, IDEA and McKinney-Vento funds can only be used for populations identified. However, Title IV-A is open for all, so to speak. Additionally, schools can partner with local organizations to develop a stipend fund, so to speak, that will assist families in need or partner with the local FQHC or federally qualified healthcare center to provide students with care who do not have health insurance. As stated, these are generally billable services. Therefore, schools should work to establish appropriate processes to bill accordingly for services rendered. But on the side of mental health supports, schools have more options. As part of the webinar material, you are provided with Georgia's mental health allowable federal funding funnel. This funnel is generic, so this funnel is generic, although it says Georgia. These are federally based regulations. This funnel provides insight on how you can braid and blend federal title funding programs together to support students. The funnel shows the most flexible dollars at the top or the most wide part of the funnel and narrows to the least flexible dollars as you see it in the graphic. These funds are those used to pay for school-based curriculums, professional development, universal programming, and family engagement. The key to using these funds is writing your story. Just about all funding in the education space is tied to a data-driven story or analysis. The eligibility of your use of funds is directly tied to documenting why you need to use X funds to do Y intervention. If you are stating that mental health services are needed in schools, what data drove you to this intervention and why this intervention over others? Again, your data-driven story is what creates allowable funding, not selecting the intervention, then figuring out the funding. A spin to this discussion is the ESSER, or Elementary and Secondary School Emergency Relief Funds, that were deployed as part of CARES 1, 2, and 3, so to speak. These funds have been earmarked to be used for mental health, for student mental health. However, each state will define what mental health means. Is it mental health services or supports as we previously defined? I encourage you to have local discussions about how these funds can be used. In summary, to leverage funds across all 3 tiers, you will need to develop an appropriate strategy. For tiers 1, school funding can be used to improve these supports. Refer to the allowable federal funding example that I provided. Remember, school's responsibility is to educate the child. Mental health development is a skill that is taught. For tier 2, you can use target population funds to impact those students, but generally for tiers 2 and 3, you will want to look at federal programs, but also stimulate appropriate local partners, like the stipend fund example I gave, through philanthropic or partnering with an organization that can build to these for services for these particular students.
Oh, thank you so much for that. Just a quick follow-up question. What would be your key piece of advice for schools that may be just beginning to address school mental health using these funding sources?
I will probably say 2 things. One of them is be sure to explore what is currently in place. There's a multitude of programs that are in services that are already kind of out there. An example that I'll give is, I remember working with a school that kept telling me that they wanted to implement a new reading program. However, when I looked at their mapping process, actually one of the other modules that's available in the toolkit is the teaming module. I use that, and Janet and everybody at the MHTC is very familiar with my usage of that particular tool. But using that tool really did allow us to map out everything. So we had 3 reading partners that were partnering with the school, but again, they were all servicing the same kids. So it was a matter of us looking at which program could service other populations of students and looking at what is currently in place. The second thing that I would probably say is be sure to develop a strong tier 1 intervention so that you don't overburden your tiers 2 and tier 3 supports. The first thought shouldn't be mental health services for all. Not everyone needs mental health services. Yes, everyone needs mental health support. When I work with schools and I see that they have a large percentage of schools in tiers 2 and 3, I immediately question the efficacy of their tier 1 support. Are we doing upstream prevention, or are we doing more over identification? Are we doing more training around how students can stay maintained in their classroom? Because everyone's goal is to keep kids in the classroom so that they can learn. Or is it more situations of sitting that student out? So supporting students in the classroom, I really look at that conversation as a will or a skill issue. Will being, are they unable to? Or is it a skill issue that they do not know how to? So again, making sure that you're just paying a lot of attention to a strong tier 1 so that you don't overburden your tiers 2 and tiers 3.
Oh, thank you so much for that. I'm now gonna ask a question of our second panelist, Adam. Adam, why do you think Medicaid is generally considered to be the #1 source of funding for school mental health services? And then on the flip side, are there any factors that you see as potentially standing in the way of even greater sums of Medicaid dollars being allocated to support school mental health services?
Yes, thank you, Dr. Cummings, and thank you, everyone. Good to see you all. Absolutely, Medicaid is an important source of financing for school mental health services in general, and at the same time, there are a number of barriers to accessing services through Medicaid. It's a complex topic with way more nuance than we have time for today. But let me start with just a few key reasons why Medicaid is such a big deal in this context. I should say first that most of what I have to say pertains both to Medicaid and CHIP, the Children's Health Insurance Program. And for those who don't know, Medicaid and CHIP are similar programs, but they cover children with slightly different household income. Medicaid covers individuals at the lowest end, and CHIP covers youth in low-income families that are not quite eligible for Medicaid. So with that said, one of the main reasons why Medicaid and CHIP are important in school mental health is that combined, the 2 programs cover about 2 out of every 5 children in the US, 40%. And that proportion is, of course, much higher in lower income communities. In some communities, nearly all children are eligible for Medicaid. Medicaid is also disproportionately likely to be a source of coverage for children with mental health needs. Now, there's another reason Medicaid is important for school mental health, and that's because Medicaid's benefits are actually quite generous. Medicaid covers a large number of tier 3 school mental health services, including therapy services and medications, as well as many screening services. Now, in particular, I wanted to point out the EPSDT benefit, which all state Medicaid programs must cover for enrollees under age 21. EPSDT stands for Early and Periodic Screening, Diagnostic, and Treatment. It's a mouthful. Many folks know that EPSDT covers a wide range of behavioral health and other screening services. But then for any child identified as potentially having a mental health or other health problem, Medicaid must also cover the diagnostic tests to specify the child's mental or medical care need, and also the treatment services determined to be medically necessary to control or correct the problem. So to be clear, even if a certain service isn't covered under the state's Medicaid plan, under EPSDT, Medicaid has to cover the service so long as the child's mental health condition was identified and diagnosed through EPSDT covered screenings and diagnostic tests, which is pretty cool. It's a very comprehensive benefit, and it's probably underutilized in the school mental health context. Now, there are a few reasons for that, and I can get back to that if there's interest a bit later on. I also want to point out that our school mental health team here in the Southeast MHTC region has put together several resources on EPSDT and other relevant dimensions of Medicaid and other financing sources too for school mental health. We are putting the links to some of those in the chat now alongside a link to the full list of resources our centers put together, so please do check those out. There are a few other reasons why Medicaid is important in school mental health, including some policy overlap with IDEA. For those who are familiar with the Individuals with Disabilities Education Act, Medicaid will often cover all of the medical services listed in a child's IEP, or Individualized Education Program. These are IDEA eligible children I'm referring to, if they're also Medicaid eligible. In addition, many LEAs may not yet be aware that Medicaid will often pay for LEA's administrative expenses if they're related to Medicaid. So things like outreach efforts or enrollment support and other related duties, those can be covered through Medicaid-funded cost-based reimbursement systems. And Medicaid is also flexible from a policy perspective. So for example, in recent years, some states have tweaked regulations to make school nurses and other LEA staff eligible for Medicaid reimbursement. So that's a lot of things in Medicaid's favor. So many kids are enrolled in Medicaid. Medicaid has generous coverage terms, but part of your question was what keeps LEAs from leveraging Medicaid more? So, well, first, not all kids are eligible for Medicaid. And then not all kids that are eligible for Medicaid are actually enrolled in Medicaid. About 1 out of every 14 children who are eligible for Medicaid are not enrolled in the program. The process of verifying eligibility for Medicaid varies from state to state, like so many other Medicaid parameters, and it can be onerous for families. And then eligibility has to be re-verified with some frequency in order to sustain coverage. So it's not at all uncommon for Medicaid enrollees to slip in and out of coverage and become uninsured periodically. Second, many Tier 1 and Tier 2 services are not covered under Medicaid. While Medicaid covers most of the Tier 3 services you might think of and some Tier 2 services, some other services like school-wide behavioral and trauma screening or promotion and prevention programs have to be paid for through non-Medicaid sources. Now, fortunately, like Ashley was talking about, there are some other Department of Education and other sources that can be used to finance those kinds of services, so that may not be such a big detriment. Next, in about 3/4 of states, nearly all Medicaid enrolled children are actually enrolled in a Medicaid managed care plan of some kind. These are private insurance companies that contract with the state to administer benefits for Medicaid enrollees on the state's behalf. And so often, billing Medicaid for services is not just as simple as billing one large health insurer, if that's simple, but rather it may mean billing maybe 3, 4, or 5 different plans operating in your area. And working with Medicaid managed care plans can be intimidating or frustrating for different reasons. And so we've heard many LEAs may just not want to make the investment to figure that all out. It's tricky. For another barrier, there are lots of nuances to Medicaid rules to adhere to, and these also change over time, of course. These changes can be tricky to keep track of, and then if you're looking for resources to help orient yourself to those rules in your state or what to do about them, unfortunately, Medicaid program rules vary so much from state to state that it can often be difficult to get good guidance about how to approach Medicaid in any one state. Now, there are national organizations like the Kaiser Family Foundation that do a good job of tracking these things at a high level, but they might not provide the specific guidance you're looking for. And then lastly, we are all aware that there is a massive shortage of pediatric mental health care providers in most areas of the country, and some communities have no such providers at all. But then on top of that, in many communities that have providers, many of those providers will not accept Medicaid patients. And this is significantly because what Medicaid pays for a given service is often much less than what private insurers or higher income self-pay patients might pay. Now, Medicaid is just not built to overcome the absence of suitable, willing providers in a community. So there are other barriers too, but that's probably enough on Medicaid for now.
Oh, thank you so much. That was an incredible amount of Medicaid knowledge packed into just a few minutes. Really, really appreciate that. And I see some questions in our Q&A pod, lots of interest in digging more into these topics, and hopefully we can circle back around during the Q&A portion. Next, I'd like to ask a question of Lynn, who has experience leading an agency and obtaining new state funding to support school mental health. So Lynn, when you were mental health commissioner of Alabama, you worked with stakeholders to secure additional funding from the state legislature to support and expand school mental health. So could you tell us a little bit more about what exactly did Alabama do here?
Sure. When I became commissioner in 2017, it was with the clear goal to implement mental health crisis care centers across the state. And when I learned about school-based mental health, expanding those services also became a primary focus. One reason is that as a former nurse, I approach solutions from the perspective that prevention and early intervention produce a better outcome, as well as saving time and money. I appreciate the opportunity to share how we were able to achieve a tremendous amount during my term, and I want to emphasize 4 factors: relationships, persistence, trust, and timing. At the beginning of my term, the school-based mental health program was a small partnership between 13 of our 19 mental health centers, but included only 53 out of Alabama's 137 public school systems. The 13 mental health centers had agreements with those 53 LEAs to provide in-school therapists in a private designated place in the school. So when I arrived in July of 2017, the 2018 budget was already set. Our focus then was to expand the school mental health program through the 2019 budget request. Part of our securing new funding for this program was due to timing of a committed new governor, our work to build trust with her office and the legislature, and sadly, a national tragedy. The catastrophic Parkland High School shooting was on Valentine's Day of 2018, as you know, so student mental health again moved into the spotlight. Our governor immediately established the SAFE Council with major department heads as leaders. SAFE stands for Securing Alabama's Facilities of Education, and as commissioner, I was on the council. The school-based mental health program was one of the 10 focus areas, so elected officials became fully aware of the program and the importance of mental health for students. While no one would want this to be the way that school-based mental health became a major focus, that was the circumstance in which we found ourselves as we worked with our legislature and governor to secure additional funding for expansion. We did receive $500,000 in fiscal year 2019 to provide $50,000 to a community mental health center to initiate a program, and that resulted in 2 new sites that year. 10 new sites opened in FY20 with the additional $500,000, and the department received $750,000 for this current fiscal year to open 15 new sites, and I have received word that it expects to receive another $750,000 for next year for continued expansion. All 19 of Alabama's community mental health centers now have a school-based program in at least 1 school in their multi-county region, with a total now of 77 of Alabama's 137 LEAs involved. In the fall of 2018, I had the great fortune to meet Dr. Janet Cummings and to learn about the technical assistance at the regional and national levels. She and her team have been extremely generous in their availability as we set about growing our relationship with the Department of Education to expand the commitment to school-based mental health, as well as the number of programs. As we and the Department of Education gained greater understanding of the importance of Tier 1 and Tier 2 services, we collaborated to envision a new position in the mental health workforce. Our joint goal was to create a position of mental health service coordinator that would work for each LEA and be responsible for coordination and support of student mental health services, including tiers 1, 2, and 3 throughout the school district. One vital player from our Department of Mental Health in this success story was our legislative liaison, who worked with her counterpart at Education to write the bill to create and fund the mental health service coordinator position. This further demonstrated the value of focusing on our common goal of improved student mental health and of obtaining increased funding to sustain and expand the work. Other key players, of course, were the governor, her finance office staff, and the House Majority Leader in the Alabama legislature. The governor charged him in the summer of 2019 to be both champion and chair of a bipartisan committee of senators and representatives to focus on the broad category of mental health. They led the effort that culminated in a mental health legislative day in February of 2020 with unanimous support for our department in the fiscal year 21 budget to obtain that $750,000 to expand sites for Tier 3 services, and for the Education Department to receive $4.5 million to implement the Tier 2 mental health service coordinator position. The other factor aiding our cause was that 3 other commissioners, without any request from me, that from prisons, Department of Human Resources, and the State Department of Education, all 3 had emphasized to the governor and the legislature in that their primary issues were regarding the mental health of those that they serve. The bottom line is this: due to persistence of messaging and action by our department, strong support by the governor's office, a tireless and courageous champion in the legislature, collaboration with the Department of Education, and support from other state agencies, new funding was secured for school mental health during a pandemic in a state with constrained resources. It's a wonderful story, and we'd be glad to share more later.
Oh, thank you so much for that. That's an incredible success story, and just such a great example of being able to secure additional funding for school mental health with all of these other forces working possibly against you. But I think so many lessons and kernels of wisdom there. Now, I'd like to switch gears here for a second and ask a question that all of the panelists have a chance to answer. And in this case, I'd like us to go in reverse order. So Lynn, I'll have you answer first, followed by Adam, Ashley, and then Nancy, I'd love to have you chime in as well. So we've talked about a lot of funding sources, federal sources, Department of Education, Medicaid, new state funds. And so I'd like to ask everyone, how resilient have the funding sources you all just described been during the pandemic? And then how do you see the pandemic, the related economic downturn, and other related factors affecting sustainability of these sources of financing moving forward? So Lynn, would you like to offer us a couple of words on that particular issue?
Sure, and it's important to note that I have not been the commissioner now for since December, so this is definitely a work in progress. But what is important for the participants to know is that Alabama is not an expansion state, but about half of our births are paid by Medicaid. And we, of course, have it for children who meet the threshold for services. And we also have the All Kids program, which is that gap coverage of the SCHIP. What's very interesting is that the schools or the mental health centers are the billers, of course, for the services. The therapists are an employee of the mental health center. But the children who do not have a funding stream in Alabama often are the children with Blue Cross insurance. They are by far the dominant provider of private insurance in the state, and they do not cover services that are not provided in the office. They will not cover services in the school. The Medicaid reimbursement that is received is a tremendous help, of course, but it does not, of course, account for the time the therapist spends not doing direct services, such as working with the staff, educating them, maybe managing a crisis at the school that's not billable. Those services, of course, are crucial, but not reimbursable through insurance.
Thank you. Adam, do you have anything to add to how we can think about sustainability, particularly with respect to Medicaid and what that might look like going forward?
Yeah, I'll keep my comments focused on Medicaid here. Overall, I would say Medicaid is a pretty persistent and reliable funding source across years, despite what I was alluding to earlier about all the year-to-year changes in the program. That said, in most years, in most states maybe, there will be rumblings about cuts in Medicaid. Medicaid tends to be a scapegoat for any state budget concerns, since it is most states' #1 line item expense at around 25% of the state budget. That's a really big ticket item. Now, during the pandemic, maybe to help illustrate, the accompanying economic downturn actually hits Medicaid hard in 2 ways. One, when the economy is down and unemployment goes up, demand for Medicaid coverage goes up. So there's been a lot of increased demand for Medicaid recently. And then also when the economy is down, state revenues are significantly down because of reduced income taxes and reduced sales taxes. So that leaves a lot less money to pay for Medicaid despite the increasing demand for coverage. I actually gave a webinar presentation about these issues last July. So if folks are interested in seeing more discussion about these issues, please do again, check out the link to that webinar recording on the Southeast MHTTC website. Now, in the last several months of the pandemic, the federal government has agreed a few times to foot larger shares of the bill for Medicaid than they would normally under the FMAP matching arrangement. And that reduces states' burden, but still many states have been facing pretty dire budget situations and tough choices to try and make ends meet. Now, some states might look to restrict Medicaid eligibility or restrict terms of coverage or reduce reimbursement. Now, all 3 of those things are hard for different reasons. It's also possible that states might just reduce the number of staff that they employ in Medicaid offices, and that might slow down a number of different processes in some ways. But that said, during the public health emergency, states actually have some expanded authority to modify the program. So the Center for Budget and Policy Priorities put out a report late last year that documented some of these ways that Medicaid programs actually expanded the generosity of their programs, even if it does make the program a little bit more expensive for the state, including things like easing requirements for verifying eligibility and expanding coverage of certain services like COVID testing and telemedicine. So in the end, I would say it's worthwhile to check in periodically on Medicaid policy changes in our states because they will change. But especially in an era when popular opinion of Medicaid is improving and there's goodwill towards the program, major cuts in the program seem pretty unlikely, and perhaps particularly during a public health emergency.
For me, I would say, much like what Adam just shared about Medicaid, majority of the funding that I mentioned today has been in the education system for years. Federal programs dollars such as Title IV-A, McKinney-Vento, or IDEA are generally resilient, including the fluctuations that even Adam mentioned to earlier. However, this is our first pandemic since the creation of those funds. So what will happen with those funds? I am hopeful that they will remain resilient, but then we also just have to acknowledge that this is the first time that those funds have experienced a pandemic along with us. The funding source that comes into question are really more philanthropic in ESSER, or the Elementary and Secondary School Relief Fund. emergency relief, I'm sorry. But those dollars are the ones that are specifically earmarked for education in the CARES 1, 2, and 3, so to speak. And those funds do expire in September of 2024. I also talk about philanthropy because donations or fundraisers may not be what it was in historic times. And however, larger organizations may have more funding for specific causes due to this pandemic time. So again, in closing, a note about ESSER, or again, the elementary and secondary school emergency relief. As we begin to implement these various interventions, it is of the utmost importance that we think about sustainability. Look at these funds as seed money and ask the question, what large projects can we fund with seed money that will free up other funds or projects so that we will be able to, that we necessarily wouldn't usually have the funding to do. So again, this is seed money and the newer dollars that are coming in to free up some of those others, understanding that again, those ESSER funds do have the expiration of 2024. This now allows you to reallocate that funding that you necessarily saved by using the fund seed money to sustain some of the various interventions and initiatives that you may implement at this time.
Great. Do you have anything any additional words of wisdom to add to that, Nancy?
Absolutely. This has been probably one of the most popular questions that we've been getting recently. And I feel like my response is in agreement with what we've been hearing from the other panelists. And so we definitely recommend using relief funding to both meet acute needs, but also to build sustainable infrastructure that can help support longer-term school mental health system needs. We've seen funding used to support things like needs assessment, listening forums, strategic planning. We want to make sure that we're getting it right in terms of what needs to come next. Relief dollars have been used to enhance school community partnerships, to offer more school-based services and supports, to build screening and data systems that can support identification, triaging, and following up with students and families, as well as to inform the impact of school mental health service provision. We hope that funds will be used to build longer-term capacity and particularly encourage states and districts to consider using funds to hire school mental health coordinators who can build capacity by establishing comprehensive multi-tiered systems of support that build on family school community partnerships. With a growing number of students reporting increased mental health challenges, including depression, anxiety, we cannot tackle the needs of students with only Tier 3 services and support. So we need to strengthen our Tier 1 and 2 supports, can really help our schools and districts to reach a broader number of students with proactive, prevention-oriented strategies. Some other ideas, we definitely have lots of ideas for this. Other ideas for how to use relief dollars include implementing organizational and individual strategies to promote educator well-being, offering mental health literacy for K-12 staff and students, integrating social emotional learning into the curricula, assessing and advancing positive school climate, hiring, retaining, offering professional development to a full continuum of student support professionals, such as school psychologists, social workers, and school counselors, establishing formal partnerships with community health and behavioral health providers to provide school mental health services and supports and to facilitate referrals. So we want to have a strong school employed network as well as our community partner network. So it's not one or the other, but both end. And these are just really some of the examples. There's lots of different possibilities, but regardless, it's important to make sure we're advancing quality and capacity.
Thank you so much for that. We've been having a number of questions coming in our Q&A pod, and we've been monitoring those. And so I'd like to have the chance to ask a couple of follow-up questions of our panelists. I believe the first question that came in that we'd like to cover is for Ashley. Ashley, how do you think about the trade-offs between funding for instruction versus for Tier 1 mental health supports?
It really is going to be based on what the local school district has identified as their priorities. So when we start talking about the funding sources, again, I always say, look at what's going on, map out everything, use the teaming module from the MHTC. Like, I cannot argue that enough, because it will allow you to be able to see immediately where there is duplication of service and support. So right now we can all say everybody is working tremendously hard to impact this particular effort. But is it that we're working too hard because we have not streamlined appropriately? So again, no, it's not a thing of you're trading off one for the other. It really is making sure that you're addressing all needs by way of doing the proper assessment to make sure that you are spending in the appropriate manner, you have the right staffing in the appropriate manner, and you're coordinated with your community partners as much as possible.
Thanks. A lot of great insight there. Had a couple of questions come in for Adam about EPSDT. So I'm just going to roll it into one question, since you said you had a little bit more you could share with us on EPSDT. Can you mentioned that EPSDT may be underutilized, and you could say a bit more about that. And could you also speak to how best to advise LEAs to leverage EPSDT?
Yeah, so to be brief, I think the one thing I would say first is that I did copy the links to a couple of resources our center has put together on EPSDT into the Q&A pod. So if you're interested in seeing more about the basics of EPSDT and how it can be used in this context, I would encourage you to go there. One of our resources was also more specifically about this question of why it may be underutilized. And I think a lot of it has to do with the workforce shortage. So I can imagine that lots of LEAs would be very interested in identifying more precisely who are the kids in their districts who have these mental health conditions that you'd like to address, and then hand them off to a community provider so that they could have those needs met. But if you're not going to be able to find a provider in the community to meet that child's needs, there's not much point to screening and starting that chain of events with the EPSDT benefit. You'd much rather just use those same staff resources for other purposes, maybe even supporting instructional needs, if you're not, perfectly aligned in using the teaming module like Ashley suggested. And so instead of using the EPSDT benefit to its full, to the hilt, if you have a shortage of providers, EPSDT is sort of a secondary concern. So I think in a lot of communities, EPSDT is particularly underutilized because of the shortage. So again, check out those resources on our website for further insight on that.
Thanks so much for that. Let's see, we've had a question come in about foundation funding. So I'm going to pose this, and perhaps Ashley or Nancy could chime in on this one. What major foundations might help supplement funding for school mental health that you're aware of?
It's a hard question. I would definitely say start with your local philanthropic organizations first. I always notice that most of the local organizations usually have some type of particular funding or kind of a pulse on what's happening in their community. So they've already started fundraising towards those particular initiatives. So I would definitely stay at your local level first before you start to radiate out into the larger organizations that are nationally based. However, there hasn't been a comprehensive list that I can list off, and Nancy, I'll pass it over to you. Maybe you have some additional information, but I would definitely say stay at your local level as much as possible, because again, they are the ones that's going to have kind of the pulse and the thumb on exactly what's happening in your community and be able to kind of radiate and raise the funds that are needed for the particular incidents that are happening.
I do want to call out the Annie Casey Foundation, the Bainham Family Foundation. There are foundations that have invested in school mental health. Sometimes they are regional, really learning about whether it's what you have available in your state or in your region. Often it may not necessarily be a plan or a grant that already exists where they're saying we're looking for school mental health. This is where we can get creative. We've had some fantastic opportunities. Sometimes what we're able to do through our private foundations, they can often do like the seed funding for a great idea And then once you have some of that data, once you have that information, you can take it and bring that to a much greater funding opportunity. But it doesn't hurt to ask and to look to see what's available. We do, when we send out resources from today, we can make sure to include some links for how to find out more about private foundations.
Great. And now I think we have time for one more question, very quick. This final question is for Lynn. Cassandra was asking, Lynn, could you repeat your 4 words that led to the success of securing new funding for school mental health in the state of Alabama? You're on mute.
Thank you for the question. Relationships, persistence, trust, and timing. All of those things had to come together.